Hi, this is Meenakshi Jolly. Today we will talk about how weather affects patients with lupus. So there are three things: when it is humid, raining, sun, or when it is cold. These things affect patients with lupus. When it rains outside or it is humid outside, joints may begin to hurt. When it is sunny and you go out in the sun, you may break out into rashes in various parts of your body, whichever is exposed. Sometimes doctors describe this as photosensitivity. When you go out in the sun, even for a little bit of time, you may break out into a rash or have a full-blown flare of your lupus. When it is cold, lupus patients can have Raynaud's phenomenon, that is changing of the color of your hands or feet. They may go from white, blue, red, or even tingle sometimes the tip of the fingers or toes, and this is called Raynaud's phenomenon. Means what to do to deal with these effects of lupus on your body due to weather changes. Keep the temperature inside the house at a level that is comfortable with you and your body, with your joints. The other thing is, when you go out in the sun, even if it is cloudy, you need to wear a sunscreen. The sunscreen should be a broad spectrum sunscreen, and you should reapply it every 3 to 4 hours. Very important that you put sunscreen especially on the areas that are exposed to the sun. Sometimes I see that lupus patients try to avoid putting sunscreen on their face or such because it's a thick material. There are several preparations available in Walgreens, Walmart, and CVS that are now available that have SPF 50 and higher, that are not so thick materials that you can put on your face, and these work very well. The key is to apply it daily. Even if you're out for 2 seconds, you should apply it, and the key is to reapply it after every 4 to 5 hours and include the areas, especially the face, neck, where you're putting the sunscreen. When it is cold, try to dress up warmly when you go. In fact, try to dress up warmly 5 to 10 minutes before you actually step out. It is useful to wear 2 layerings of gloves or layerings of clothing to keep your hands or feet warm. If you feel that you have real problem with Raynaud's phenomenon, that your fingertips or such become numb, or you have sores over your hands or feet, then sometimes even using a warmer inside your gloves or inside the pockets may be helpful. Do talk to your doctors about it, and there are some medications that can help with that. I hope this was useful.